Welcome to Baby Care Basics. This is Kiva Fontanelle. I'm a registered nurse at St. Tammany Parish Hospital, and I've been here since 1999. I have always worked in mother-baby areas in every area, and currently work the maternal fetal medicine clinic. Today we're going to talk about your amazing baby. We're going to talk about what they look like, how they act, and how to best care for them. Hi. My name is Kiva Fontanelle. I am a registered nurse here at St. Tammany Health Systems. I have been here since 1999, always have worked in the mother-baby area doing all the different jobs, and currently I am the nurse at the maternal fetal medicine clinic that St. Tammany partners with Ochsner, and we see high-risk pregnancy patients. So I may have seen some of you throughout your pregnancy. Welcome to Baby Care Basics. Today we're going to be talking about your amazing new baby. We will talk specifically about the newborn phase when you're in the hospital, and we will also talk about the first days and weeks after you get home. We will talk about how your baby will look, what to expect, some normal things, some things that are very common, and how to treat those things, and just some basic baby care. So let's go ahead and get started. Your amazing baby. At birth, your amazing baby will have distinctive physical characteristics that are common among newborns. In this course, we will be talking about the first days and weeks following delivery. In the first moments, hours, and days of your baby's life, they will change in their appearance. At first, your baby's head may appear long, pointy, or misshapen, look too large for the body, have a lot of hair, or a little hair, or none at all. You may notice two soft spots on your baby's head, one in the front and another a little bit further towards the back. These soft spots are places where the bones on the skull have not finished growing and fusing together. It allows the head to change shape as needed to be able to safely exit the body during the labor process. Over time, these soft spots will disappear as the bones continue to grow and fuse together, but in the meantime, just be careful with those spots and protect them while caring for your baby. If your baby's head is misshapen because of the delivery process, no worries. It all works out and evens out in the first hours and days and resolves. In the meantime, we'll be happy to issue you an adorable hat to cover it up. You may notice your baby's head may appear long, pointy, or misshapen. It may look too large for the body, have a lot of hair, a little hair, or no hair at all. You may also notice two soft spots on your baby's head, one on the top and one closer to the back. These are soft spaces where the bones on the skull have not finished growing and fusing together. These spaces allow the skull to have room to move and mold so that they can go through the birth canal. Your baby's eyes may look moist from eye drops or ointment placed in them at birth. They may appear swollen, unfocused, or even crossed, and all of that is normal. I would like to point out that we do delay putting a small ribbon of antibiotic ointment on their lower lashes. This coats the eye and helps prevent any eye infection. As the babies have gone through the birth canal in the birthing process, it's not uncommon for them to maybe pick up a little bit of bacteria, and this prevents them from getting an eye infection. But we do delay that until after the first hour of life. We typically like to promote as much bonding as possible in that first hour, and included in that is their ability to see you as clearly as possible. So we do that, but we typically delay it just a little bit. This slide always gives me a laugh because I love to look at the faces of our participants. A lot of times with these pictures, we get all kind of strange faces. Yes, all of these things are normal, and your baby may have some of them, all of them, or none of them. So some things that are normal about newborn baby skin. Initially after delivery, you may notice that they may have some vernix. The vernix, the best that I can describe it is that it almost looks like cottage cheese. Yes, it is usually accumulated in the creases, especially in the crease of the arm near the elbow, in the folds of the neck, and that sort of thing. It is an organic, natural coating that coats the baby as they're in utero. They have been suspended in water for quite some time, and this keeps them from getting waterlogged. Do you ever think about why they don't come out waterlogged after they've been suspended in fluid for such a long time? This is their natural coating that does protect their skin. Once they're born, it absorbs into the skin. It's just like a natural lotion almost, and we wipe some of it off in the process of drying them, but the remainder of it will absorb, and it's just a natural thing, nothing wrong with that. And then also some of your babies may have wrinkled, red, or peeling skin. Typically, as you know, humans are sloughing skin cells all the time. We're always getting new cells and replacing the old ones. As the babies have been in utero, you typically will see wrinkled or peeling skin on babies that are past their due date, because their skin is ready to slough off and make new skin cells because they're big now and they've used it. So you will typically see that with babies that might be a little bit past due. Don't pick at it. You don't have to do anything with it. We do have small bottles of lotion. You can lotion it. It will wear off in the right amount of time. And then also, it's really common for a baby's complexion to appear very blotchy. They have been through quite a process, and it is no wonder that their skin tone may be a little blotchy, and within the first 2 days, all of that really resolves. So that's some of the normal things that you may see, and you may not see any of it, but if you do, it's all normal. I realized that I likened the vernix to cottage cheese. I'm wrong, not cottage cheese. I meant to say cream cheese. Yes, it looks like cream cheese, so sorry about that, but it does look like cream cheese on their skin. You also may notice a couple of things, maybe cradle cap or lanugo. Cradle cap is where the scalp looks scaly. It's really an excess buildup of skin cells and oil and that sort of thing. And then the soft, smooth little fine hairs that you'll see on your newborn, that's called lanugo. A lot of times it's on their back, shoulders, cheeks, and forehead. Some babies are hairy when they're born and some are not. Usually it wears off and they don't stay with that. With the cradle cap, if you notice that, you can go to one of the local pharmacies, whichever you prefer, and they typically have a lotion that you can ask the pharmacist for. It should be on the shelf, and you just put that on there, let it sit, you comb it out, and the cradle cap comes out with it. Easy fix. Final attempt on baby's genitals and breasts. As we started from the top, we're moving our way all the way down to the bottom. Your baby's genitals and breasts will most likely appear swollen immediately following delivery. Honestly, pretty much everything about a newborn appears to be swollen. Their eyes, their little hands seem puffy, they do retain some fluid, and they will lose weight in the first days of life. That is very common. Sometimes you may notice, if you're changing your daughter's diaper, that you may notice a little bit of a pink tinged discharge at her bottom. It's nothing to be concerned about. Through the delivery process, sometimes a small dose of mom's hormones transfer to baby. Her body's just metabolizing that out, getting rid of it. But in the meantime, you may notice a little bit of that pink tinge. At any time, if you notice anything with the baby that's concerning to you, or you just quite don't remember if that's normal or not, don't ever hesitate to call the nurse and ask them to take a look and reassure you. An umbilical cord typically has 2 arteries and 1 vein, and if we did not clamp it, it would bleed. So we clamp it with a plastic clamp, and the outside of that touches the air and it dries up and it seals itself together. Before they go home, we'll take that clamp off and it'll be left with a little dried stump almost of the umbilical cord. We're going to tell you how to take care of that as you're home and what to expect. All right, let's talk about baby reflexes. This is what babies do. They don't have to be taught. They're just born knowing how to do these things. For instance, they know how to suck and swallow. This is a natural reflex. It occurs when the lips are touched or when the baby is hungry. Sometimes you'll notice babies have been sucking on their hands or their arm in utero. They'll suck on their fingers, just various things. And typically this is something that a term baby will know how to do. Preterm babies that are a little early and born early have to still master this. So they may not be very good with this, but term babies definitely. The rooting reflex is another reflex. It occurs when an object is touched to the cheek or corner of mouth or when they're hungry. This I always liken to like a baby bird trying to get the worm from the mom. They're shaking their head from side to side, just going left and right, trying to get that food. That is what newborn babies will do when they're very hungry. Another one is called the Moro or startle reflex. So the baby can be lying there quietly, and then all of a sudden, and usually in response to loud sounds or sudden movements, they'll have this sudden jerky flinging out of their arms and legs. It's kind of startling for the parent because you think, ooh, what just happened? But they're fine. They just naturally do that on occasion. And then something else is the grasp reflex. And this occurs when an object. Your baby's breathing as a newborn is going to be irregular. It's not going to be irregular in one way. It will be irregular in pretty much every way. My best advice is do not stare at your baby breathing. As long as your baby's lips and gums and tongue are pink, they're getting enough oxygen and they are fine. If for some reason you ever notice that your baby's lips are blue or gray or purple, rub the bottom of their feet, aggravate them, make them cry. They'll get plenty of oxygen in and pink right up. But as long as your baby's lips are pink, no need to worry. You will notice, however, with your newborn that their breathing is irregular in depth, rate, and rhythm. They breathe rapidly and then progressively deeper breaths. They breathe twice as fast as we do, 30 to 60 breaths per minute, and they often pause between some of their breaths, which can be really nerve-wracking. This is all normal newborn breathing. Babies have spontaneous behaviors that they're born naturally doing. Some of these are coughing and sneezing, spitting up, passing gas, quivering their lower lip and chin, yawning, and getting hiccups. Often we're concerned about coughing and sneezing, associating that with sickness. However, with a newborn, they have not yet learned to clear their throat when there's mucus in the back of the throat or blow their nose, so their body naturally induces a sneeze to clear the air passages or a cough to clear the throat naturally. They also spit up small amounts, very normal. Always make sure that you have something on your shoulder, a cloth diaper, a cloth, a towel, something covering your shoulder if you're holding your baby up, because at some point they will dribble and spit on you. Very normal, very natural. However, it's easy just to take that little cloth, throw it in the washing machine. You're not having to change clothes and change shirts. Passing gas, quivering of the lower lip and chin, they can do these things on cue as they grow up, but as a newborn, it's just things they do naturally. Yawning and hiccups. Hiccups can look very disturbing for a newborn because they're so small, it really shakes their whole body, but it doesn't seem to bother them at all, and they will go away on their own. You will notice that they have hiccups often. You may even notice that they have hiccups often in utero, and you're feeling them now with the hiccups. At St. Tammany Health Systems, we are very, very conscious of bonding. We want families, mothers and babies, fathers and babies, to bond as quickly and as strongly as possible. We find that research shows us that long-term stability and healthy families begin in those first moments. So we encourage that in a lot of different ways that you'll notice as you are a patient here at St. Tammany. The benefits of bonding for your baby. Bonding is the process of falling in love with your baby. And notice that word process. Bonding creates trust in you, in the environment, and in others, bonding builds self-assurance. This is very important for baby's proper growth and development. In the process of taking care of your baby's everyday needs, you will notice the bond that you have with your baby to strengthen. To strengthen that bond, respond quickly to your baby's cries. Learn to accurately read your baby's unique facial expressions, body movements, and sounds, their cues. As you learn your baby, you will begin to learn the different body language that they have to express themselves, to let you know that they're starting to get hungry or starting to get tired or they're wet or dirty. Babies eventually will cry to communicate a need, not to manipulate, and you cannot spoil a newborn baby. If you remember back over the first days and weeks of a new relationship with your significant other or someone else that you love, you may remember learning that person's body language and cues. Even now, we can laugh at when we notice that our significant other begins to get hangry because they distinctively have some cues that let us know. Same thing with your baby. You will learn their cues, their body language, their change in behavior, that cues what they're trying to communicate. In the first moments, hours, days of life, we begin observing and learning our newborns. We allow 24-hour rooming in, and this gives baby and mom the opportunity to be together with as little separation as possible. That time allows for mom and baby to get to know each other. If the baby cries, mom or caregiver is able to quickly respond, building and cementing that trust. Mom learns to recognize her baby's early hunger cues. She's right there able to observe. Some early hunger cues that you may observe are sucking motions with their mouths, sticking out their tongues, puckering their lips, moving their hands to their mouth, moving their bodies, and opening their mouth and moving their head side to side, the rooting reflex. These are all some of the things that you may notice that they begin to do, cueing you that they're starting to get hungry. You may notice that your baby's been resting contently and quietly, and then starting to get a little wiggly and starting to move around somewhat, bringing their hands to their mouth, sucking on things. These can let you know that the baby is starting to get hungry. We bond with our babies also by interacting with them. We can hold them as often as possible. We can cradle our babies chest to chest, skin to skin, and let our babies touch and feel our faces. We make eye contact with them. We use our face as a toy, making lots of different big expressions. We can talk to them and sing to them. Crying is part of the normal newborn experience. We will experience them crying throughout this stage. What do you do when you have a crying baby? Well, of course, we try to soothe them the best that we know. We can place them skin to skin. In the early weeks, we can swaddle them, rock them, play background noise like a recording of the ocean or some other monotonous sound, electric fans, vacuum cleaners. Holding your baby is a delightful job. You will spend a lot of time holding your baby. You need to feed them, comfort them, play with them, bond with them. You'll be carrying them, and just for fun. Newborns are not able to get from point A to point B, obviously, so we will be holding them a great deal, especially in the beginning. It is very important that we always remember to wash our hands before handling our baby. We also can encourage our guests and visitors and friends to wash their hands thoroughly before handling the baby. Washing between the fingers, on the back of the hands, on the palm of the hands with warm, soapy water, long enough to sing the happy birthday song twice. That's an effective way and an effective length of time to wash our hands to rid them of germs. When lifting your baby, you always want to support their neck and their head. Put one hand behind their neck and head and the other under their bottom. When you're holding your baby, keep a hand behind the baby's neck because they do not yet have strong enough neck muscles to hold their head up on their own. So for the first few weeks, it will be our job to hold their neck and their head for them. You want to use smooth movements when lifting and putting them down. You want to keep a firm but gentle grip, and never shake your baby. This is the point in the presentation where I ask my class and look at everyone and ask them, at some point, do you think that you may feel like you want to shake your baby? And most people stare at me blankly, but the truth is, throughout children's lifetime, at some point, yes, you may feel like you want to shake your baby, and that's okay. But do not shake your baby. If you feel frustrated and overwhelmed, sometimes you just need to take a break. Setting them in their crib and walking away is perfectly fine. They're safe there. After we've washed them and changed them and bathed them and tried to soothe them, sometimes we just don't know what else to do, and we need to take a breath and take a break. If you have a friend or someone that you can call to take a break sometimes, that would be great. Sometimes you have to put the baby in the stroller and walk around the block. But pre-think, what are some good ideas in those times when you're tired and frustrated and maybe a little overwhelmed and you just don't have patience for the moment? The most common way that we hold our babies is the cradle hold. It's the most common hold for safety and comfort. We hold the baby on the forearm close to our bodies. We use our forearm to support the baby's back, and they nestle their head in the crook of our arm. We use our hand to secure their bottom as well. The football hold is a very popular way to hold your baby when you're trying to accomplish something else and you need a free hand. When they're small enough, you can do this hold by using your dominant arm. If you're predominantly right-handed, then use your right hand. If you're predominantly left-handed, use your left. Place a hand under the baby's head. Use your other hand to lift their bottom closely to your body and tuck them, their body and their legs, under your arm. You can use your forearm to support the body. If you notice in the picture how the lady is holding her baby, she is able to have a free hand to do something else. It's very similar to tucking a football under your arm. When you place your baby over your shoulder to hold them, notice in the picture how the lady is holding her baby's head and supporting its head and neck. Place your baby high against your chest with the head over your shoulder. Support their head and neck with one hand and support their bottom securely with the other hand. In the early weeks when they're still small, they enjoy being swaddled. If you think about it, they've been in utero, kind of in a very confined space, and I think they feel secure that way. Swaddling is most helpful during the first 4 to 6 weeks of life. Discontinue swaddling as the baby becomes more active, if the baby becomes overheated, or if they just don't like to be swaddled, and they will let you know. Over time, they'll start sticking a foot out and just getting out of the swaddle and getting irritated with it. That lets you know they do not want to be swaddled anymore. This is the point in the presentation that you can pause it, and if you have a lightweight baby blanket, go retrieve it and you can practice while we talk about it. Then you'll bring the bottom point up, and you don't want it to cover the baby's face, so you can fold it under or fold it back to where it's not too tall. This slide recommends that you tuck it behind the baby. I usually put it on the baby's belly and just fold it down so it doesn't cover the baby's face. And then you'll want to tuck the other arm into the blanket when you pull the right point across and tuck it behind your baby. And again, the more firmly you can pull and tuck that right side around your baby to swaddle them, the better. They like to feel nice and secure. As we've mentioned, using a lightweight, breathable cotton material is best. Make sure the blanket is tucked away from the baby's face, and always check your baby for overheating. Colic. Some of you may have been told that you were a colicky baby. Colic is when a baby has uncontrollable crying that can last for hours. Baby is tense, the fists are clenched, the legs are drawn up. The cause is unknown, but usually this diminishes by 3 to 4 months of age. Remain calm and remember to never shake your baby. If I had to guess as to what is going on with the baby, it appears that the baby has a stomach ache. There are little drops that you can buy. I think they're called Mylicon drops. You can go to your pharmacy. They're little drops that you can put in the baby's mouth, and it helps dissolve any extra uncomfortable air bubbles. You can try that. But sometimes you do everything you know to do. You change them, you rock them, swaddle them, feed them, bathe them, all the things, and they're still just not settled. These are the times that we need to do those things that we've already thought through. It's very trying to have a baby crying for hours for 3 to possibly 4 months at a time. Dr. Harvey Karp has come up with the cuddle cure. He thinks that there are 5 S's that can help the baby get settled. Swaddle them, stomach or side in your arms only, not in the bed, shushing, swinging, and letting them suck on something. We already know how to swaddle them. Once they're swaddled, you can hold them stomach to stomach on you, or you can lay them on their stomach or on their side when they're in your arms. Shushing, shh, 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 shh. If you realize they are hearing your heartbeat swishing constantly as they are in utero, it's a very familiar sound to them when they're born. Swinging, they like motion. I think it distracts them a little bit. And sucking on things. If a baby's crying, they have to be able to close their mouths and stop crying to be able to suck on a pacifier, on their thumb, on the breast, on a bottle, something. It says at the bottom, this must be done in this order. Well, if you can remember to try any of them, congratulations. But he recommends swaddling, holding them on their stomach or side, shushing, swinging, and sucking. If you remember, I told you earlier that we would explain to you how to take care of the umbilical cord. We do clamp the cord. We take that clamp off before you go home, and it's left with a little dried stump that looks like a little pumpkin stem. The umbilical cord will fall off on its own within 1 to 4 weeks in its own time. Some doctors recommend using alcohol on the stump, and some do not. We used to always swab where the skin meets the cord to keep it clean, and we thought that it would make it dry up and fall off faster. However, research shows that there's no difference in the timing, but if you want to do that, you feel like you're keeping it clean, you're more than welcome. It will not harm. Follow your doctor's instructions carefully on whatever it is that they tell you to do. This slide of this umbilical cord is actually not very typical. The skin around the umbilical cord on the baby's belly is usually not peely and all of that. It's just like regular skin. To help the cord fall off as quickly as possible, we need to keep the area dry at all times. So that means no submerging the baby's belly or the umbilical cord in water. You don't want the cord to get wet. It's drying out, and if you get it wet, it will absorb the water like a wick, and it will get mushy and stinky and nasty. So you don't want that. Keep the cord area dry. Expose it to air as much as possible. So you're going to want to keep the top of their diapers folded down so it's exposed to the air. And then of course you don't want any tight clothing that could rub the cord excessively and possibly cause it to come off too soon. After you leave the hospital, you will expect to have to do a follow-up visit with your pediatrician. This is done no later than the first week of life for the baby, and it's a checkup. They're going to check the baby's weight and measurements, see how feeding is going, and another thing that they will do is to check the baby's umbilical cord. Most doctors recommend sponge bathing only until the cord has fallen off, again so that it doesn't get wet and it can continue to dry out. Allow the cord to drop off on its own. Do not pull the cord. And again, on your checkup, the doctor will check it for you. When the umbilical cord falls off, you may see a drop or two of occasional bleeding from irritation there, and that's normal. But if the bleeding continues, if you see more than just 1 or 2 drops of bright red blood, if the cord area appears red and swollen, meaning the skin around the cord, the skin should just be normal skin like all the rest of the skin on the body. It should not be puffy, warm, red, raised, nothing of the sort. If the cord oozes pus or is foul smelling, or if the baby develops fever, please let the doctor know. If you're having a boy baby, you might opt to have him circumcised. This is something for you to read about and consider and talk over and decide. We have paperwork that you would sign to give permission if you want your baby circumcised. Most of the time, the physicians, the OBs, will do the circumcisions in the hospital on the 2nd day of life, after the baby is 24 hours old. They numb the area prior to the procedure, and we let you know when they're going to have it done, and we will give you all the instructions at the bedside and demonstrate for you how to take care of your son's circumcision. A circumcision is the removal of the foreskin that covers the tip of the penis. The tip of the penis will look slightly red afterwards and swollen for a few days. As it heals, you'll notice a wet scab. It's going to be yellowish and a crusty material that may develop around the tip. You do not have to wipe that off. The penis will heal in about 10 to 14 days. In the meantime, you just be very gentle with the area and clean it with as little rubbing or irritation as possible. So again, always wash your hands thoroughly before handling the baby and before taking care of your baby's circumcision. Keep the area clean and dry. You don't want them to sit in urine or stool for any length of time. It's very irritating to that freshly exposed skin. With each diaper change, rinse with plain, clean water by dripping it from a saturated washcloth. No rubbing involved. Just try to flush it with the warm water on a washcloth. Cover the tip of the penis with petroleum jelly. We are going to give you a tube of petroleum jelly. It's easiest to aim and get it in the right spot, or you can put a dollop in the front of the diaper and then just aim well to where the tip of the penis will get into the Vaseline. We do that because that new fresh layer of skin is moist, is making a scab and healing, and we don't want it to stick to the diaper, and then as we change the diapers, we're pulling it and causing discomfort. When to call the doctor. Call your baby's doctor if you have any concerns or questions. Call if you notice any of the following: new or increased swelling or redness, new bleeding that does not stop, a foul odor, drainage from circumcision, or if your baby can't urinate. I've been a nurse here at St. Tammany, as you know, for 20 plus years, and we have not had a baby, to my knowledge, not do well with their circumcision. Care for it well. Look for any signs and symptoms of infection. You can always call your physician if you have any questions or concerns. They usually do very, very well. If you opt not to circumcise your baby, just clean your son with soap and water when bathing or as needed. Do not try to pull the foreskin back. Allow the foreskin to retract on its own. Jaundice is the yellowing of the skin and the whites of the eyes. It's very common for newborns to have a yellowish tinge to them, especially around day 3 or 4 of life. This is something that is part of their daily assessment. It's something that we check on and look at every day in the nursery. Bilirubin is built up in the bloodstream, and it causes a yellowish coloring. Bilirubin is the waste products of our red blood cells. Our body naturally removes them through bowel movements, indirect sunlight, and our livers also work on getting rid of the excess. Bowel movements for newborns will progressively change over the first days of life into the next weeks of life. It's very normal, but if you haven't been around newborns or babies, you wouldn't know. The first stools of a newborn are black and sticky. They are very much like tar. By day 3 or 4, the stools become a little more frequent, and they get a little lighter in color, and they often look dark green. By the 5th to 7th day, the stools are more frequent, about 3 to 6 times per day, and they start to change color. The stools appear soft and yellowish tan in color, and they have small curds. They look seedy. And then by 4 to 6 weeks, the number of stools may decrease in frequency and start to have more of a routine. So just know that the stools are normally black and sticky at first over the first days up to the first week, and into the first month they're going to continue to progressively change in color and consistency, and then about a month and a little over a month old it'll get a little bit more regular and routine. Voiding. Newborns may urinate every 1 to 3 hours. That is a lot of diaper changes. By the first week, there should be 4 to 6 wet diapers in 24 hours. Urine should be nearly clear, just like ours should be nearly clear because that lets us know we're hydrated well enough. Call the doctor if the urine is dark or rust colored. These may be signs of dehydration. I want you to note that in the first days of life, we have very reasonable goals for their voiding and stooling. For the first 24 hours of life, we only expect 1 wet diaper. So on day 1, we expect 1 wet diaper. On day 2, we will expect 2 wet diapers. On day 3 and so forth. As your milk comes in, if you're breastfeeding, you will notice their hydration increases and their frequency of urination will also increase. But for the first day of life, we only expect 1 wet diaper and 2 on the second. When you come to the hospital, we're going to give you a chart and we'll leave it with you in the room so that when the baby's with you, whenever they void or stool, you can write it down. There's a little graph. Write down the time and whether they voided or stooled. This lets us know how well hydrated they are. And if you're a breastfeeding mom, of course we can't see the volume that's going into the baby as they're drinking, but exactly what they're voiding is what they're taking in. So that helps us know how well they're being nourished. So as you've probably gathered so far, there will be a lot of diaper changing. Diaper changing can seem complicated, but with a little practice, you're going to become a pro. Not hard. We do encourage you to change each diaper as soon as it becomes wet or soiled if you can help it. A newborn may use 10 to 12 diapers a day. A baby will use 2,500 to 2,700 diapers a year. When getting ready to change your baby's diaper, preparation is key. We encourage you to gather all your supplies before beginning to change a diaper. We would not want you to be tempted to leave the baby alone to go grab one more supply that you may have forgotten. So try to collect everything together before you begin. You're going to want a clean disposable or cloth diaper, whichever you choose to use, clean wet washcloth or an alcohol-free baby wipe. Does not need to be scented, preferred not scented. A changing pad, something to put under their bottom so when you're changing, if they leak anywhere, it won't soil the carpet or the bedding or whatever they're on. Fasteners, if you're using cloth diapers, ointment, and no baby powder. Baby powder has very fine dust particles that can coat the lining of the lungs and cause the baby to not be able to get enough oxygen. So just to be safe, we say no baby powder. Again, washing your hands with warm soapy water is key before and after changing your baby. You're going to want to use safety straps if you have them on a changing table. Keep one hand on the baby at all times. If there's a shelf below the table and you need to lean down to get something, put your hand on the baby's belly and then lean down and get what you need. Never walk away or turn your back, not even for a second. Babies learn to roll over, but you don't know when that will be. They start to move their legs, one leg crosses over the body, they get used to doing that, and then before you know it, flip, they're able to flip over. You wouldn't want that to be on a day that you weren't holding on to them or had them strapped in safely on the changing table. When changing your baby, remove the soiled diaper. When you unattach the 2 tabs on the side or unpin the cloth diaper, you can use the front of the diaper to remove some of the stool, as shown in the picture. Use a damp washcloth or baby wipe to clean the area thoroughly. Wipe from front to back, using clean area of the cloth for each wipe. You want to make sure you get in all the creases of the female baby and all of the creases of the boy baby. Especially for female babies, if stool gets to the urethra where the opening is that the urine comes out of, it is very easy for that bacteria to travel a short distance to get to the bladder and cause a urinary tract infection. The pathway to the bladder for boys is a longer distance, and they're not as likely to get a UTI. So especially with little girls, it's important to teach them as they're growing to always wipe from front to back and not allow that stool to get to the urethra. When the babies are small, it's easy to hold both of their feet in one of your hands and be able to gently lift them to put the clean diaper underneath their bottom. After the back of the diaper is about hip level, you can pull the front of the diaper up and between the legs. Align the top edge of the diaper with the belly button. Fold the top of the diaper down and away from the cord like we talked about before. And then you're going to fasten on either side. Remember that the side of the diaper that is going to be lying on the surface behind the baby is the one with the tabs. For disposable diapers, you're going to pull the self-stick tabs diagonally over the top of the corners across basically the hip bones. For cloth diapers, you're going to secure carefully with safety pins. For cloth diaper wraps, secure using Velcro or snaps. Over the course of the diaper years, you may come across diaper rash. Diaper rash is caused from prolonged contact with urine and stool along with the friction of the diaper, and it can cause a bright red rash. Diaper rash can be prevented or minimized at least by changing soiled diapers right away, cleaning the bottom and genital area very well, using unscented wipes or plain water, and exposing the bottom to fresh air on a regular basis. Skin that has moisture on it over long periods of time is more prone to breaking down and getting irritated, especially with stool or urine. So we want to make sure that those diapers stay clean, and that after you've cleaned them, that they are dry before you put on the next diaper. A good barrier cream, I recommend Boudreaux's butt paste, but there are other brands out there. It's a preventable as well as a treatment. After you clean the baby and the baby is very dry, you can always put a thin layer of diaper rash cream on their bottom to prevent that urine and stool from sitting directly on the skin. It's kind of like a little barrier. So if you'd like to do that, you can. No matter how diligent you are, your baby may still get diaper rash. If the baby does, do not rub the sore area. Wash the area well with clean, warm water. If you have to use a bulb syringe, which we'll talk about how to use it later, you can use that to rinse it with warm water so that you don't have to rub them clean. Pat the area dry with a soft cloth to remove moisture. Let the area air dry when possible, and use diaper ointments. You can always call your doctor or speak with the nurse at the doctor's office regarding this if you have concerns. Sometimes a diaper rash can be compounded with a yeast infection as well on the bottom. This is extremely painful and extremely sore. You may notice white patches or raised whelps on the skin as well as redness. If you are at all concerned about your baby's skin, your baby's bottom, by all means, feel free to call the physician or speak to the nurse anytime you have any concerns. Sudden infant death syndrome, or SIDS, is the sudden death of a healthy infant, less than 1 year of age. Putting infants to sleep on their backs, we found, reduces the risk of SIDS. There are other steps that can reduce the risk of SIDS and keep your baby safe. In the definition of SIDS, you'll notice the words healthy infant. These infants, as far as we can tell, don't have any other risk factors or problems that would cause them to pass prior to the first year of age. What we can do is research each individual situation and find some common denominators, eliminate those common denominators, thus reducing the risk of SIDS. To reduce the risk of SIDS, we can place our baby on his or her back for all naps and at bedtimes. We can have the baby sleep in a bed near the parent's bed. Not smoking during pregnancy reduces the risk of SIDS. Not exposing the baby to secondhand smoke also reduces the risk of SIDS. Breastfeeding 1 month exclusively reduces the risk of SIDS by 50%. Avoiding overheating. Providing the baby with supervised tummy time. Making sure all caregivers know to place the baby on their backs to sleep. I want to speak about tummy time. Tummy time is important. We very much push back to sleep. Put the babies on their back to sleep. But tummy time is also very important. It helps them to learn to push up, hold their heads up, and develop muscles in their back and in their bodies and skills that they need. So putting a blanket on the floor, putting the baby on their tummy with supervision is also an important part. It can be fun as we get close to delivery to think about what pieces of furniture that we want to use for the baby, or just collect the things that we will use. Part of these things include cribs. Purchase a crib that meets all the safety standards. Purchase a firm mattress that fits securely in the crib. Use sheets that fit tightly on the mattress, and remove all soft items and loose bedding from the crib. All of this reduces the opportunity for any of these things to get stuffed by the baby's face, to occlude their breathing, or even for the baby to get trapped between the mattress and the bars of the crib or the backboard of the crib. So we just need everything to fit as it's supposed to and minimize what's inside of the crib. I would like to also point out that some of the older vintage cribs have larger spacing in the bars than is safe. So you may want to look at what the safety recommendation is if you plan to use a vintage crib, and make sure that it meets the safety requirements, that the baby's head cannot get stuck in the bars. You may have considered buying pacifiers or been gifted some pacifiers thus far. Studies have shown that offering a pacifier can reduce the risk of SIDS. The American Academy of Pediatrics recommends delaying pacifier introduction until 1 month of age to ensure that breastfeeding is firmly established. A pacifier should only be offered at nap time and at bedtime. Sucking on a pacifier is easier in a different motion than drinking from the breast. So to introduce 2 different methods of sucking can be confusing. It's easier to establish that breastfeeding well first and then introduce the pacifier. Bath time. Bath time is a special time to bond with your baby. Preparation for bath time, just like diaper changing, is very important. Gather all your supplies and have them within reach before you begin. Set your water heater below 120 degrees Fahrenheit to prevent scalding. Gather all supplies needed and have them within reach. Bathe in a warm, draft-free room. Test the bath water temperature. It should be about 100 degrees. Keep one hand on your baby at all times, and never place a cotton swab or any pointy, sharp object in your baby's ears, eyes, or nose. Never leave your baby to answer the phone or the door or to retrieve an item, not even for 1 second. If you remember, we talked about not bathing the baby fully, submerging into water, until after the umbilical cord has fallen off. In the meantime, we'll do a sponge bath. A sponge bath is when you fill a small basin with warm water. You're going to test the water with your elbow to make sure that it is not too hot or too cold. You're going to lay your baby on a soft towel or a blanket, undress your baby down to the diaper. And to keep the baby covered during bath time is the best way to keep them warm. Just expose one body part at a time, so you can cover them lightly, or even leave the diaper on and take the rest, everything else off. Cover the baby lightly with a little blanket or a towel. Expose one arm, bubble up and wipe off that arm, rinse it, dry it, cover that arm, uncover the next arm. Do that arm. Wash, rinse, dry, cover that arm, and go to each body part in that fashion. Avoid the umbilical cord, clean around the umbilical cord on the abdomen, and do the rest of the baby. To clean the baby's eyes, dip a corner of a washcloth in warm water, squeeze out the excess water, and wipe the eyes from the inside away from the nose. Use a clean corner of the cloth for the other eye. You'll want to use a clean, damp washcloth to wipe one side of the face at a time. Next, clean the ear and neck area. Make sure that you get the folds in the baby's neck and right behind the baby's ear. Of course, do not cover your baby's face with the washcloth. When you wash their body, uncover only a small area of the body at a time. Use a mild soap for washing. Wash and rinse the chest, the arms, and the hands first, the upper body. Next, you'll wash their limbs. Wash their legs, their thighs, and their feet. Remember to clean under their arms, in the creases of their elbows, behind their knees, between their fingers and toes. And lastly, we'll wash the genital area. Their bottoms really shouldn't be that dirty. You've been cleaning them throughout the day. Remove the diaper and clean the bottom and genital area. Wipe from the front to the back. Clean in all the folds and wrap the baby in a clean, dry towel. Now that they're wrapped in a nice, warm, dry towel, you can wash their hair. Hold the baby securely in the football hold. Wet their hair by squeezing clean, warm water from the washcloth, or you can even put it under the faucet if you're by the kitchen sink or a place where that's convenient. Apply a small amount of tearless shampoo to the scalp and rub briskly but gently into a lather. You can use a washcloth or you can use your hands. Of course, keep the shampoo out of their eyes. Rinse with clean, warm water. Towel dry and gently brush their hair with a baby brush. Regular shampooing and gentle brushing of the scalp with a soft brush may help prevent cradle cap. Once the umbilical cord falls off and the circumcision is fully healed, infants can be tub bathed. Since infants do not get dirty, tub baths 2 or 3 times a week with spot cleaning of the face, neck, and bottom are sufficient. You'll notice that your baby's fingernails grow quickly, and they can be sharp. You may even notice that they appear to be long and sharp on the day of delivery. To prevent injuries to baby's eyes and face, keep their nails trimmed and smooth. Because skin grows under the fingernail, the safest tool for trimming and smoothing is an emery board. As we said earlier, it's not if your baby spits up, it's when your baby spits up. Spitting up and bulb suctioning. Your baby may spit up small amounts from their mouth and their nose. Bulb suctioning helps to remove this. Take the bulb suction in your hand, squeeze first, insert the bulb syringe into the baby's mouth between the cheek and the gums, and then release. I emphasized squeeze first. If you take a bulb syringe and you squeeze it toward yourself, you will feel a puff of air come out. You don't want to blow a puff of air down your child's throat or up their nose. They will not appreciate it. So squeeze the bulb suction first, slide it on the inside of their cheek toward the back of their mouth between the gum and the cheek, not in the middle because it will trigger their gag reflex, along the side, and then let it re-inflate. As it re-inflates, it will draw in anything that is there. Squeeze and insert the bulb syringe into each nostril and release. So again, you're going to squeeze the bulb syringe, then put it right in the tip of the baby's nostril and gently let it re-inflate, pulling out any mucus or anything that would be there. If you wonder whether you should do their nose or their mouth first, it's in alphabetical order. L-M-N-O-P. M-N. Mouth first, then the nose. Always suction the baby's mouth before the nose if secretions or milk is present in both. Before I became a nurse, I thought that breastfeeding and bottle feeding were the same, just different. But now I've learned that they are very different. It's important for parents to research and learn about both methods of feeding and decide what's best for your family. The American Academy of Pediatrics and the World Health Organization strongly advise breastfeeding as the sole form of nutrition for infants under 6 months of age, and to continue breastfeeding until at least 1 year of age, or 2 years. The benefits of breastfeeding for baby are that the longer you breastfeed, the more your baby's immune system can benefit from breast milk. The first milk that comes in is called colostrum, and if you were to express it and look at it, you would notice that it is a bright, sunflowery yellow color. We call it liquid gold. It's a yellowish fluid produced by the breasts in the first few days of life. This colostrum is high in carbs, protein, and antibodies. Antibodies build the baby's immune system. It has a mild laxative effect for the first bowel movements. It's made by you just for your baby's needs. No substitute is exactly the same. The benefits of breastfeeding for mom: one is that nursing burns extra calories, up to 500 extra calories a day, which can help you shed pregnancy pounds. So while you're just being mom and producing milk without trying, you're burning about 500 extra calories a day. It also releases oxytocin. This returns your uterus to the normal size and decreases bleeding. It can save time and money. You don't have anything to purchase, measure, or mix. There are no bottles or nipples to sterilize. Breast milk is sterile. It is known to prevent cancer for the breast, ovarian cancer, and osteoporosis. And of course, it's a good opportunity for bonding as you're taking that time with your baby. Every baby is going to have his or her own feeding pattern. Let your baby breastfeed as much as he or she wants, especially in those first days. No certain amount of time to feed from the breast. Some people are fast eaters, some people are slow eaters. Let the baby nurse until releases the breast or falls asleep. You may offer the other breast if the baby is still hungry after the first breast. Your baby should be breastfed 8 or more times in a 24-hour period. Feeding patterns may differ from one day to the next. When babies are going through growth spurts, of course they want to eat more. Some feedings may be clustered close together or a few hours apart. Do not expect your baby to sleep through the night during the first few weeks or months of life. This is normal for all babies. Breast milk digests easily and quickly. Around 72 hours after birth, the milk will change in color and in the amount. So within the first few days of life, you'll notice that your breasts will get more full and more volume of fluid. The baby's stomach size will also increase. At birth, their stomach is only about the size of a walnut. They can't hold very much and they use it up quickly. That's why they eat so often. As your baby needs more, your body will make more. It's a supply and demand. As we wind down our presentation, we wanted to take a minute and answer a couple of questions that you may have regarding the experience and what to expect when you go to the hospital. We often get asked who can be in the delivery room. We allow one support person, family member, significant other with you. You can also expect a nurse for you, the mom, a nurse for the baby, your doctor that will deliver, and a helper for the doctor, a scrub tech who will hand him his supplies or her supplies and whatever that they need for the delivery. In a vaginal delivery, that team is in the room. We deliver in the room. Our rooms are LDRP rooms. So you go through the labor process, you deliver, you recover, and you have your postpartum time all in the same room. You don't move rooms throughout your experience. The room that you check into is the room that you check out of. In a C-section, we do the same thing. You check into a room, We get you ready for your C-section. You go to the C-section area, your baby's delivered. We give you that time together with your baby, that first magical hour, which is the same that we do in a vaginal delivery. We bring you back to your room where you recover and you stay until it's time for you to go home. We do encourage you to breastfeed within that first hour after delivery. You can initiate that on your own, or we are happy to help you with that. We'll be right there with you. So long as you're okay with it, we do encourage what we call kangaroo care, or skin to skin, for that first hour or until the completion of the first breastfeeding. We do allow you to room in so you don't have to be separated from your baby. If your baby goes to the NICU, our priority is to have you and baby together as quickly and as soon as possible. Sometimes babies go to the NICU, the neonatal intensive care unit, for observation for a short period of time, or for treatment if necessary. But in either circumstance, we make it our business to very frequently communicate with you to let you know what is going on and to allow you to be at the bedside with your baby as much as possible. During your baby's stay, you may wonder, what are some of the things that I can expect to be done for my baby while I'm at St. Tammany? The baby will immediately be assessed by a nurse and a pediatrician. We typically give injections of vitamin K and hepatitis B. They get a ribbon of erythromycin eye ointment on the lower lashes. We will do a newborn screening, which is a blood test. They prick the heel and get a drop of blood for what's called the PKU. We'll do a hearing screening to ensure that all of the parts of the ear work properly. If you have a boy and you desire for him to be circumcised, we'll do that. We take pictures, professional pictures. The photographer will come to your room and ask you if you would like to have family pictures done. We will check your baby's oxygen level every day, which we call pulse ox tests. And we will fill out a form with baby footprints and their identity bracelet to ensure that you're bringing home the right baby. I'd like you to note that all procedures, such as vitamin K and hepatitis B injections, the PKU, hearing screening, circumcisions, all of these things are done with consent. When you arrive at the hospital, we go through each of these things and let you sign for understanding on each of these individual tasks. If at any time you would not like your baby to have one of these things done, you absolutely can let the staff know. Becoming a new parent is exciting, but it's also exhausting. The labor process can bring hours of not sleeping or discomfort, and after the baby is delivered, it is really important that mom and support person rests. So each day we have quiet time from 1:30 to 3:30. This is a time of the day where we discourage visitors from coming. We encourage you to plan around this time. Plan to rest, plan to take a nap, plan to watch a movie. Just be still and recuperate. Having visitors is a blessing, but it can also be exhausting when you're recuperating from delivery. So expect quiet time from 1:30 to 3:30 p.m. daily. Mom, baby, and champion, who is your support person, rests and bond in the mother's room undisturbed. Visitors are asked to not come at this time. Staff interruptions are limited. Other helpful information is that you may notice on our name badges there's a pink stripe across our name. That means that we work on this unit. Our unit is a locked unit to ensure safety for mom and baby. All doors are locked, and only those with a pink stripe across their badge are able to swipe and enter the unit. We do not have nurses from other units working on our unit, and we don't go to other units and come back to work on ours. In other places of the hospital, the patients are sick, and that is why they're here. On New Family Center, our moms aren't sick, they're just having a baby. We don't want to bring those germs and cross-contaminate. So those that work on our unit, stay on our unit. Only approved personnel have the pink stripe across their badge to care for you and your baby. We do have certified lactation consultants on staff available 24 hours a day. If you are a breastfeeding mom, they will come by your room and ensure that you are comfortable with feeding your baby before you go home. The birth certificate worksheet will be filled out while you're here. It will be applied for, and you can expect the birth certificate and the Social Security card for your new baby to arrive at the address that you put, probably your home, within the next few months. Choose a pediatrician in advance. Ask for suggestions from friends and loved ones. Interview them. Set up a meeting with them if you like. Prior to coming to the hospital, it's important that you know which pediatrician that you would like the baby to see afterwards, because you will be going for a 1-week checkup to check baby's weight, how they're feeding, circumcision, umbilical cord, all of these things. St. Tammany Health Systems does have the Parenting Center to support you throughout your baby and child's lifetime. We have support groups, we have play groups, we have breastfeeding groups, we have all kinds of things to support you. So look that up, the Parenting Center for St. Tammany Parish Hospital. You will need a car seat to bring the baby home. And if you have any questions, we are happy to answer them. Thank you for joining us for the online Baby Care Basics presentation. I hope it's been informative. I hope you've learned something new. We're excited for you as you look forward to your upcoming arrival of your amazing baby. If you have any questions, please email the Women and Children's Services Clinical Director, Dee Giovingo, at stph.org. DGIOVINGO at stph.org, and she will forward your email to the appropriate instructor.